Hello, and thank you for your interest in learning more about the evaluation process to be a live kidney donor. This video will provide an overview of the tests, examinations, and evaluations required to be a live kidney donor. We will also discuss the team of professionals who will assist you during this phase of the process. Let's get started. The primary reason for the evaluation is to determine if there are any medical conditions or other risks that would prevent you from donating a kidney. Your transplant program determines your ability to donate based on the program's guidelines and clinical judgment of the transplant team. The live kidney donor evaluation includes the following: a detailed health history. A health history asks questions about conditions you may have, like heart disease, cancer, or medication you take. A general family history. Similar to your own health, you will be asked about the health of siblings, parents, and grandparents. Social history. You will meet with a transplant social worker who will ask you questions about your relationships, work, finances, and other activities. Physical exam. You will have a physical exam that includes measuring your height, weight, blood pressure, and assessing all major body systems. Laboratory and imaging tests. You will have multiple tubes of blood drawn from your arm to evaluate your kidney function, liver function, cholesterol levels, the presence of diabetes, blood disorders, blood type, and other tests. In addition, your urine will be tested to evaluate kidney function. You will also have an electrocardiogram or EKG to assess your heart and a chest X-ray to assess your lungs. A CT of the abdomen will also be done to help assess the size and structure of your kidneys. Screening for transmissible disease. You will be screened for certain transmissible diseases, which include hepatitis B, hepatitis C, HIV, cytomegalovirus, Epstein-Barr virus, and syphilis. If you live in an area known to have a transmissible disease specific to that area, like West Nile virus or Zika virus, additional screening may be completed. In some cases, certain diseases detected by the transplant hospital may require disclosure to local, state, and federal public health authorities. Cancer screening. The evaluation will also include routine cancer screenings. Commonly screened cancers include cervical cancer, breast cancer, prostate cancer, colon cancer, and lung cancer. Examples of expenses you may be responsible for include travel to the transplant center for evaluation, time away from work that is not paid, childcare costs, etc. The good news is that there are programs to assist live kidney donors to offset these types of expenses, and some employers provide paid time off for absences related to kidney donation. A member of your transplant team will assist you with knowing which programs might be available to you. As you can see, there are a number of tests completed to determine your eligibility to be a live kidney donor. On occasion, the transplant team may discover a condition unknown to the donor. With newer genetic testing, risks can be more precisely identified. Sometimes this may be a serious condition like cancer or a heart condition. It's good to identify these conditions so they can be treated appropriately, but doing so will have an associated expense that will be the responsibility of the donor. There are also some general medical risks associated with the live kidney donor evaluation. These risks are specific to the evaluation tests. For example, you will have your blood drawn from your arm and may experience bruising or soreness around the site. You may have a CT exam that uses an IV contrast. Some people have an allergic reaction to IV contrast. Other risks include: on rare occasions, a patient may receive a deceased donor kidney while a friend or family member is being evaluated to be a live kidney donor. Although there is a lot to consider and complete in order to be a living donor, you are not on your own. You have an entire team of diverse transplant professionals ready to assist you along the way. Each one has special skills and responsibility to ensure you understand the process, stay informed, and make the donation process as simple and easy as possible. Your transplant team will include living donor coordinator, a nurse that helps educate and guide you through the evaluation, hospitalizations, and long-term follow-up related to donation. Nephrologist, a doctor that treats kidney disease. This doctor will provide your medical clearance for donation and will discuss the long-term consequences related to donation you must consider. Living donor surgeon, a doctor that performs the donor surgery. They will meet with you to discuss the risks associated with surgery and problems that may arise during your recovery. Social worker, a team member that will meet with you to discuss your relationships, work, finances, and other activities, assessing for additional ways our team may support you before, during, and after your donation. Independent Living Donor Advocate, ILDA. This person's role is to promote your best interest and advocate for your rights as a donor. The donor advocate will ensure that you understand the benefits, risks, and complications related to donation. Dietitian, a team member who will educate you and provide you with resources regarding nutrition and weight control. Pharmacist, a team member who will assess any risks or concerns related to current medications you are taking, as well as a resource after donation regarding medications you may be prescribed in the future. Once your evaluation is complete, your health information, including your health history, family history, social history, and test results, will be reviewed at a meeting with many of the team members you learned about earlier. The team carefully considers all of the information presented, and a decision is made regarding your eligibility to donate. Once your eligibility to donate is determined, members of the transplant team will work with you to schedule a date for the surgery. In some cases, the team determines that the risks associated with a donor make them ineligible to donate. This can be very disappointing for all of those involved. When a potential donor is declined, the donor is informed of the reasons why they would be unable to donate at that transplant program. The transplant program maintains the right to determine a donor to be ineligible for donation at their program. So if you are turned down at one program, you might be able to donate at another program that has different selection criteria. It is also important to know that the evaluation is confidential. Test results and eligibility for donation are not shared unless the donor signs a consent and directs the hospital to do so.